Your cat is sitting near you right now, maybe on the couch, maybe on the floor by your feet, and at some point today, they opened their mouth to yawn, to eat, to make that little sound they make, and you didn't look. Not really. You should have. Because there is something happening inside that mouth right now that your cat will never tell you about. Not because they don't want to, but because telling you would require them to do something that millions of years of evolution have made biologically impossible for them to do. Show weakness. Cornell University's College of Veterinary Medicine analyzed clinical records spanning more than a decade. The number they found was not a warning. It was not a worst-case scenario. It was an average. 84% of cats over the age of 3 have active dental disease at any given time. Not a mild sensitivity, not an early warning sign. Active disease, the kind that causes pain, the kind that damages organs, the kind that your cat is almost certainly experiencing right now, in silence, while you watch them do absolutely nothing to indicate that anything is wrong. That is not an accident. That is the system working exactly as it was designed. Today, I'm going to walk you through what is actually happening inside your cat's mouth in a home environment, what the disease looks like at every stage, why you cannot see it by simply looking, and what the research says about what is happening to the rest of your cat's body while the mouth quietly falls apart. Stay until the end, because the last thing I cover is something most cat owners are never told, and it explains why a dental problem that started in the mouth can end somewhere you would never expect. Let's start with 48 hours. 48 hours is the window that determines everything in feline dental health, and it begins the moment your cat finishes eating. After a meal, bacterial residue remains on the tooth surfaces. Within the first 4 hours, those bacteria begin to multiply. Within 12 hours, they begin adhering to the enamel, and at the 48-hour mark, 2 days after a single meal, the bacterial film has begun to mineralize. It has hardened. It has calcified into what veterinary dentistry calls tartar, or calculus. Once tartar forms, you cannot remove it at home, not with a dental treat, not with a water additive, not with anything that does not involve professional instrumentation. It is, at that point, fixed to the tooth, and it is the foundation on which every subsequent stage of disease is built. Here is where it matters that your cat lives inside your home. Wild and feral cats have a mechanical advantage that indoor cats do not. When a wild cat kills and consumes prey, it tears through muscle, tendon, cartilage, and bone. That process, the chewing, the tearing, the pressure, functions as a natural abrasive against the tooth surface. Fibrous tissue passes between the teeth. The physical action of eating cleans the teeth while feeding the animal. Your cat at home does none of this. Whether they eat dry kibble or wet food, they are consuming food that requires almost no sustained mechanical chewing. A cat that swallows small pieces of processed food whole or laps up soft food with minimal jaw engagement is applying almost no mechanical pressure to the tooth surface. The natural cleaning mechanism that evolved alongside feline dentition does not activate. The bacteria accumulate faster, the tartar builds sooner, and the disease progresses without interruption. A meta-analysis published in the Journal of Veterinary Dentistry found no statistically significant difference in periodontal disease prevalence between cats fed exclusively dry food versus those fed wet food. The belief that dry food protects feline teeth is one of the most persistent and most consequential myths in companion animal care. The texture of commercial cat food, wet or dry, does not replicate the mechanical abrasion of prey tissue, neither prevents tartar formation, neither addresses the fundamental issue, which is not what your cat eats, it is what never touches their teeth while they are eating it. Now I want to tell you what is happening in your home, in the hours when you are not watching. Research using validated feline grimace scales and facial action coding systems, developed in part at the Université de Montréal, documented something that fundamentally changes how we understand cat behavior. Cats actively suppress visible pain indicators when a familiar human face is present. The study used pain scores derived from facial muscle movement, brow tension, orbital tightening, muzzle position, ear angle. When a familiar person was in view, these scores dropped. When a stranger or a camera was present without a known face, the scores rose. Your cat is not stoic. Your cat is performing comfort for your benefit. When you are in the room, they look fine. When you leave, or when your attention is elsewhere, the indicators emerge. A paw raised to the side of the face, a sudden stop mid-chew, food dropped, head turned, a slow approach to the water bowl, then a pause, a retreat from food that was approached with what looked like appetite. These behaviors happen between 2 and 4 in the morning. They happen when you are working, when you are on your phone, when you are looking at something else, and by the time you turn back, the cat has reset. It looks like nothing happened, because for the cat, letting you see was never an option. Let me now walk you through the 4 stages of periodontal disease in a house cat, because the progression is specific, and knowing what each stage looks like and what it feels like for the animal changes how you read your cat's behavior. Stage 1 is gingivitis, the earliest and the only fully reversible stage. A thin layer of plaque coats the tooth surface. The gum line becomes faintly reddened. A visible red line develops along the margin where the tooth meets the gum. At this stage, there is no structural damage, no bone loss, no permanent change to the tissue. The pain, if present at all, is minimal. Most cats show no behavioral change whatsoever. This is the only window in which the disease can be stopped entirely, and this is the stage that almost no cat owner ever sees, because catching it requires looking inside your cat's mouth, closely, regularly, before there is any reason to believe something is wrong. Most people never do that, and so the window closes. Stage 2 is early periodontal disease. The inflammation has now moved below the gum line. The connective tissue that holds the tooth in place, the periodontal ligament, is beginning to break down. Tartar is now visible. Yellow or brown deposits on the lower portions of the teeth, thickest near the gum margin. Halitosis becomes noticeable, not mild, noticeable. This is the stage where most owners first sense something is off, but it is also the stage where the most common mistake is made. The bad breath is attributed to the cat. Cats just have that smell. It's always been a little like that. The explanation is applied. The window narrows further. Stage 3 is moderate periodontal disease. The gum has now receded visibly. A portion of the tooth root is exposed. The bone supporting the tooth has begun to erode. Gingival bleeding is present, often appearing as faint pink discoloration around the water bowl or on the edges of the food dish. The pain at this stage is real and constant, not acute, chronic. The kind of pain that does not produce screaming or collapse. It produces adaptation. The cat begins to chew exclusively on one side. It approaches food, eats briefly, and stops. It becomes less interested in hard treats it previously enjoyed. It drinks more water than usual because the cool liquid provides transient relief. None of these behaviors are dramatic. All of them are easy to misread. She's just getting older. He was never that into treats. She's always been a picky eater. The adaptations are normalized. The animal continues to suffer. Stage 4 is advanced periodontal disease. The supporting bone has been substantially resorbed. The tooth is mobile. It moves when touched. Some teeth may have already been lost. The oral tissue is ulcerated in places. Bacteria now enter the bloodstream on a continuous basis, not as an occasional event, but as a systemic, daily occurrence. Research published in the Journal of Veterinary Internal Medicine identified statistically significant associations between chronic periodontal disease in cats and pathological changes in the kidneys, liver, and cardiac valves. The bacteria that originate in the diseased oral cavity travel through the circulatory system and seed distant organs. The damage accumulates slowly. It compounds over years. The cat at stage 4 dental disease is not just a cat with bad teeth. It is a cat whose entire body is managing an ongoing bacterial exposure that began in the mouth. There is one more factor specific to the home environment that most discussions of feline dental health omit. Chronic psychological stress suppresses immune function in cats. This is not a behavioral observation, it is an immunological measurement. Research on indoor cats in environments with low environmental enrichment, limited space, minimal variety, reduced opportunity for species-appropriate behavior shows measurable elevation in stress hormones and concurrent reduction in immune competence. A compromised immune system cannot regulate the oral microbiome effectively. The bacterial populations that drive periodontal disease multiply with less resistance. The disease progresses faster. The home environment, if it is uniform and understimulating, is not a neutral factor in your cat's dental health. It is an active one. What can actually be done? Veterinary dental guidelines are consistent on one point. Daily toothbrushing with a species-appropriate formulation, not fluoride, not human toothpaste, applied with a soft bristled brush sized for a cat's mouth, is the most effective home intervention available. The evidence for this is not disputed. The practical reality is equally consistent. The majority of adult cats do not readily tolerate brushing, and the majority of owners do not sustain the practice. Studies on owner compliance with veterinary dental recommendations show adoption rates that drop below 20% at the 6-month follow-up point. Alternatives exist and have been evaluated. Veterinarian-approved oral gels, water additives, and specific dental chew formulations can reduce bacterial load and slow plaque accumulation. None of them replicate the mechanical effect of brushing. None of them halt disease that has already reached stage 2 or beyond. The single most impactful intervention available to any cat owner is this: a scheduled oral examination by a veterinarian, at minimum once per year, beginning before the cat reaches 3 years of age. Not when something looks wrong, not when the breath changes, before, because the stage at which this disease is caught determines what can still be saved. A stage 1 finding means the tooth survives. A stage 4 finding often means it does not. Your cat is sitting near you right now. At some point today, they will open their mouth. When they do, look, not casually. Look at the gum line, look at the color, look at whether the surface of the tooth is clean or coated. Look at whether the breath that reaches you is neutral or something else entirely. Your cat has been managing this alone for longer than you know, and they have been doing it so well that you have had no reason to suspect a thing. That is not a comfort, that is the problem. Tell me in the comments, has your cat ever had a dental procedure? How old were they when it was first caught? I read every single one. I'll see you in the next one.